I'm Elyse Thulin. I am an assistant research professor at the Institute for Firearm Injury Prevention at the University of Michigan. Firearm injuries are the leading cause of death in children and adolescents. In this video, we discuss the findings shared in Pediatrics, firearm-related tips in a statewide school anonymous reporting system, and the implications for practitioners, parents, and guardians of school-aged children. Schools use a variety of strategies to reduce the risk of firearm violence in school settings and beyond, including threat assessments. Threat assessments are a form of violence risk assessment that is concerned with individuals who have threatened to harm someone or pose a threat to harm someone or themselves. The behavioral threat assessment process encompasses identifying a threat, determining the seriousness of that threat, implementing interventions to reduce risk from that threat, and continuously assessing and monitoring the effectiveness of those interventions. Over half of K-12 schools use technology-facilitated anonymous or confidential reporting systems as part of their threat assessment process. Technology-facilitated anonymous or confidential reporting systems, also called TFERS, leverage the See Something, Say Something model, which seeks to increase citizen awareness and empowerment to report potentially dangerous items, events, and behaviors. TFERS aid in schools obtaining information from students on concerning behaviors or events they become aware of or experiencing themselves. For example, over a period of 4 school years, a statewide TFERS generated information resulting in 1,039 mental health interventions, connected 109 students who planned suicide attempts to clinical care, removed 38 weapons that were intended for school violence, and prevented 6 confirmed planned school attacks. Additionally, in a recent study, roughly 10% of tips referenced one firearm term or more. Firearm-related tips were on concerning events such as potential school shootings, interpersonal violence, bullying, suicide, gang violence, and intimidation. As compared to tips not related to firearms, those that are in regards to firearms are 5 times more likely to be classified as representing a threat to life. Most TFERs have multiple ways for students to submit information, such as through text, apps, or websites. For many students, these submission modes are viable using technology that they already own or have access to, including smartphones. The design of a TFERS is as follows. The first step in the TFERS is when a concerning behavior or event emerges. These can be behaviors or events that are actively happening, such as bullying, or a planned event that may happen in the future, such as a planned school shooting. Youth are often aware of concerning behaviors or events that are affecting other youth. Many TFERs have student-facing trainings or presentations to better enable students to recognize risk and submit a tip. When provided training, youth can identify concerning behaviors within their schools or broader communities. After a student sees or hears of a risk, youth can then use TFERs to report the concerning behavior through modes such as text, app, or a website. In most TFERs systems, information is received by trained triage staff, individuals who are trained to review, interpret, and gather additional information as needed and determine the severity of the risk as well as the urgency of response. Once determined, information can be sent to relevant responders. For example, if the tip is about bullying, the information can be sent to relevant school-based staff, such as school counselors, school social workers, or administrators. These adults are well situated to address non-urgent problems during normal school hours. For a tip that is of greater urgency, for example, a rumor about a potential planned shooting or a student exhibiting suicidal behaviors, information needs to be transmitted to emergency responders such as police or emergency medical services. These responders are able to respond at any time of day to life-threatening risk factors. Although existing in so many schools and across many states, there's a lot that we still are learning about TFERs. This includes contexts where TFERs are really helpful and those where other reporting options are more useful, such as trusted adults. This work is not possible without our partners. Check out available resources for support.